what to do if your critically ill loved one in ICU has a pneumonia and has an undiagnosed infection and has been in induced coma for 8 days now. What to do next? Stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care today. So I have an email today from Sophia, who says, "Hi Patrick, my 77-year-old dad got admitted on December the 27th with pneumonia and an undiagnosed infection to intensive care. Now he's in an induced coma for 8 days. My family are not that assertive, but I am. Now he's got bleeding in his stomach, clots on the lungs, and now he's bleeding from the mouth. The meeting was scheduled for yesterday and postponed until today, and now that time has been pushed forward for 2 hours. Are they hoping my dad will pass away so they will have to do nothing more? How can I help my dad?" Well, I'm very sorry to hear about your dad's situation, Sophia. Here's what you need to do as a first step. First of all, you need to get a second opinion. You need to get access to the medical records, or you need a consultant or advocate like myself to talk to doctors and nurses directly and find out what's really happening. So, for example, you got diagnosed with pneumonia and another undiagnosed infection. Have they done all the tests that need to go hand in hand with that? Have they covered him with broadband spectrum antibiotics if they think it's a bacterial infection? How are they treating the pneumonia? Have they targeted the right antibacterial, bacterial, or antifungal or antiviral medication? Right? If he's got bleeding in his stomach and clots on the lungs and bleeding from the mouth, here is what I think has happened. He's got a PE, pulmonary embolus, right? Then they would have started him on heparin, right, to counteract the pulmonary embolus. And now they're probably giving him too much heparin, and now he's bleeding. So heparin is a blood thinner that's given for pulmonary emboli, generally speaking, right? And now they're probably giving him too much, and now he's bleeding. So it's getting the balance right in how much heparin you're giving, basically getting rid of the PEs of the pulmonary emboli, but also getting and making sure a patient is not bleeding either, right? So with him having pulmonary emboli and pneumonia, what is his hemodynamic status, right? Is he hemodynamically stable? Is he on inotropes? Is he on vasopressors? How life-threatening is this situation? And that is why you need to get access to the medical records as quickly as possible. You need to get a second opinion for someone to look over it, right? Very, very important. Now, in terms of the meeting, that was postponed until today. Now the time has been pushed forward. It sounds all over the place. Are they hoping he will pass away so that they will have to do no more? Again, difficult to say without having all the details. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. When someone is in intensive care critically ill like your dad, there are dozens of things happening simultaneously. And unless you piece it together like a puzzle, it doesn't give me a full picture here. Whilst I have an idea what's happening, like I said, is your dad hemodynamically stable? How much heparin are they giving? Is he on inotropes? Is he on vasopressors? Does he need blood transfusions because he's bleeding, right? What are his ventilator settings? Is he getting antibiotics? Is he getting antivirals? Is he getting antifungals? What are his blood results? What are his arterial blood gas results, right? So there are many, many things that need to be addressed here and that we need to find out in order to point you in the right direction. Now, as far as the meeting is concerned, get a meeting agenda in writing. Don't go to the meeting if you don't agree to the agenda. And I also wouldn't go to a meeting unless you have full access to the medical records and you can get a second opinion. That's when I would go to a meeting, as a next step. So whilst, you have grave concerns, are they hoping she will pass away? I don't know. They might actually be doing all the right things, but I wouldn't know until I've seen the medical records, right? So I hope that helps. I have worked in critical care nursing for 25 years in 3 different countries where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that I've been consulting and advocating for families in intensive care successfully, because we have saved many, many lives with our consulting and advocacy, and you can verify that on our testimonial section, and you can verify it on our intensivecarehotline.com podcast section, where we've done client interviews. And we have helped hundreds and hundreds of members and clients over the years. And you can join, the family, so to speak, the family of members and clients that we've helped over the years, to improve their lives instantly, making sure their loved ones get best care and treatment in ICU, because you can make informed decisions. You have peace of mind, control, power, and influence. And that's also why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And I also talk to doctors and nurses directly with you or on your behalf, and I ask all the questions that you haven't even considered asking. This is exactly the case today with Sophia. Sophia doesn't even know what she's asking, what she needs to ask for, right? That's where our expertise comes in. I also represent you in family meetings with intensive care team. That's also Sophia's situation today. You're meant to go into a family meeting. I wouldn't go into a family meeting without having clinical representation from a consultant and advocate like myself, right? We also do medical record reviews in real time so that you can get a second opinion in real time. Once again, that's exactly Sophia's situation today. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send me an email to support@intensivecarehotline.com. Your questions. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com. If you click on the link, on the membership link, or if you go to intensivecaresupport.org directly in the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related there. And you also have exclusive access to 21 ebooks and 21 videos that are only exclusively accessible for our members. And all of that will help you to make informed decisions, have peace of mind, control, power, influence, so that your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care.